we are going to be turning to the voices of people, and in particular, the people that these systems, these programs that we work on every single day within the aging and disability space are meant to serve. I'm going to get up and make some space for people as we do this transition. Come on up, friends. And so I'm really, really excited that we're going to get to hear from Chelsea Mauldin of The People Say and Katie Savin of the Academy and many other affiliations who are going to help us really ground the rest of today's conversations in what people in the aging and disability communities need from policymakers, because often we forget to start there. We go straight to what's the right policy design, or what do we think in Washington, or we're really smart people, what do we think people need? So we're going to start with what do the people actually say they need from policymakers, and then that's going to help us really have, I think, much smarter and more people-centered conversations throughout the day. And I'm really excited to turn, where is he? Here, oh, he's over here waiting in the wings. Really excited to turn things over to my dear friend Indi Dutta-Gupta, who's going to lead us through this conversation. So Indi.
All right, it's great to, well, I can sort of see everyone, but it's great to see whoever I can right now. It's a very bright light up here. So I'm going to catch us up a little bit on time, but we're going to go till 11:15 or so. And we're going to just start off with Chelsea, who's going to let us know when you want us to cue the video. But so Chelsea, you've been deeply immersed, obviously, in listening to older adults do the People Say project, which I'm sure people want to hear more about and learn more about. So why don't you just tell us a little more about that, what you've been hearing, tell us about the project, what you've been hearing, what do people really want to see in terms of policy regarding the future of aging, and what are also sort of the messages that older adults want to hear from policymakers in Washington, since we know narrative and how we even think and talk about all these things matter so much. We do not have to agree on a mission statement, fortunately, but just tell us a little about that too.
Hi, everybody. I'm Chelsea Mauldin, and I am the Executive Director of the Public Policy Lab. We're a not-for-profit organization based in New York City, and what we do is we work with government agencies and philanthropies to really help improve the design and delivery of policy and public services. And we do that by using a mixture of ethnographic research, human-centered design, and change management approaches. It's sort of an unholy combination, I admit. So we have been working for many years to talk to members of the public about their needs and about their lived experiences and how those inform what they require from good policy. And over the time that we've done that, we've been frustrated that so often what we were hearing from people when we would visit with them in their workplaces, in their homes, it really sort of resided with us. And as much as we would share the insights or even quotes from that research, it wasn't something that people could sort of see and use and really interact with. So we actually had the wonderful opportunity to partner with the SCAN Foundation and with Narda and her team there to do some research around the experiences of older adults, and we were particularly looking at dual eligibles at that time. And we said, well, how about if we really try to advance this dream of making those experiences that people are having really much more present for people who can then use that data? So we really had 3 different goals with the People Say. The first was to really conduct research with older adults who we felt were underrepresented, whose voices were underrepresented in policy contexts. So we made a particular focus on low-income people, people of color, and people who live in rural or otherwise underserved areas. We wanted to make sure that what we were hearing from folks really got represented in the most compelling and powerful way possible. So rather than doing the kind of research where you go and you talk to somebody or have a focus group, we did ethnographic research where we went to people's homes, we went to their community centers, their senior centers, their workplaces, and interviewed them on video and received their permission to collect that video research and share it publicly. So the third component of the project was then building a public qualitative data platform, which is called the People Say. It's available. I won't be offended if you want to go to your phones and computers right now. It's thepeoplesay.org. And so that people could actually interact with all of this qualitative research that we had collected. And that research is now, it is searchable. You can search by plain text, but it's also been tagged by our research team. So if you want to say, what are women who earn 138% or less of federal poverty level are using Medicare but not Medicaid, which happens even in that income band, and live in these congressional districts, you can actually filter by that on the platform. So you can really kind of drill down into the specifics of different kinds of experiences, different programs, different demographics.
Do we want to show the video?
Yeah, so the question was, what do older adults want policymakers to hear? I mean, they have a lot to say. They have a lot to say about unmet policy needs. They have a lot to say about their aspirations, really basic stuff around, basic needs and how those are not being met. I think there's also some really interesting stuff around people's need to begin thinking about older age earlier in their life, that people arrive in older age without having prepared for it in a whole series of ways. There are obviously really profound themes about care and caregiving, not only the experience of needing a caregiver, but also older adults as themselves caregivers, caregiving to spouses, caregiving to children and grandchildren, and also about preparation for receiving care. We don't often, all of us, think about the fact that we're going to need care, and people's lack of preparation for that idea actually creates barriers. And then there's some really profound questions around lack of trust, a sense that policy is not for them. And we have heard that across the spectrum. We have heard that from people in red districts in rural areas. We have heard that from people in blue districts in urban areas. We have heard that across the spectrum. So we do have a little bit of video here from the platform that shares some of those voices with you.
I think policymakers should spend some time in the field. I don't think you should make any decision before you have actually walked in their shoes. Try and live on less than $500 a month. Try it. Yeah, try living on that. It's not, nobody's got an easy ride getting TANF or SNAP benefits or Medicaid. It is the poorest of the poor, and it does not meet needs.
¿Y le alcanza el dinero para ahorrar algo para el futuro?
Pues muy poco.
¿Y piensa en eso usted, en ahorrar, en prepararse de cierta forma?
Pues yo quisiera, pero hay veces que no se puede. Con lo que me da no puedo hacer muchos planes.
The healthcare in this country stinks. Why do we pay more for drugs in the United States than they pay in say, Germany or Europe? From the same drug manufacturers. I think the problem is that there's the lobbyist groups in the United States donate too much money to these politicians, and that needs to stop.
改變醫療保健呢件事啊，我會改變，即係我哋包括低收入同埋納稅人都一樣享有，大家同時享用我嗰個醫療福利。即係有時同人一樣就唔使啊，除非嗰啲富豪梗唔使啦，係咪啊？
All in all, I can't say anything bad about Medicaid or Medicare. They've been a good friend to me, and they've always been there, when I need them. So I can't say anything bad about it. I know the only thing I'm lacking as far as assistance from Medicaid and Medicare is my vision, my hearing, my teeth. I've got 8 teeth in my mouth, and I pulled every one of my own teeth because insurance just don't cover it.
I mean, it's got to be something above the survival mode. And worse is like, or at least, I don't know, if you want to work, just don't take all your benefits away. You got to have some, raise the level so that you could even do part-time something if you could, to get some money so you could even do some of those extra things you would like to do, you know? Not make it so hard for people.
Yes, I have several times. And they still, says I'm over the limit to qualify for them. But everything is so high till by me being retired, I still have the same bills that they don't have retirement price on this or that, or elderly price on this or that. I have to pay the same price that people working that's making really good money. I don't get a lot of the food that I would eat if I had the money to do it.
我會改乜嘢？我會改就即係我哋老人哋起碼啲醫療，即係全部即係幫我哋能夠包啦，同埋到老嚟嗰陣時，即係能夠俾我哋有啲依靠咯。即係政府嗰度有啲政策俾我哋可以依靠，可以唔一定要依靠啲家人。可以自己或者剩翻自己嗰陣時咧，即係譬如你依家兩公婆啫，或者你其中有一部分走咗，咁你就係剩翻自己啦嘛。你係話有仔女啫，但啲仔女唔冇咁多時間噶嘛，佢又要做工啦嘛。咁啊能夠即係嗰陣時咧，都係對我哋有一個關心，有一個依靠，使我哋能夠好好咁安樂嗰個走嗰個晚年到最後，咁樣。
I want to say that what they so often speak to are needs that are quite modest. You know, people are so reasonable. They don't have unreasonable expectations. They have such modest expectations of having a decent life. And there's actually that woman who's talking about how she doesn't get the food that she would if she had a little bit more money. She sort of pauses and she says, I might buy a steak now and again. You know, like that's the level of aspiration that people have. And I think it's important to remember when we're having these conversations that what people are looking for from policymakers is really just the ability to have a decent life. And that's something that I really believe that everybody in this room can, make real for them.
Thank you, Chelsea, and thank you for sharing that. Katie, let me pull you into the conversation. I've had a sneak peek into some of your rich qualitative research, looking at how people experience programs intended to support people with disabilities. What can you share with us about what you're learning?
Sure. Thank you so much. Hi, everyone. I'm Katie Savin. I'm an assistant professor at Sac State in California, and I'm a Ford Fellow in Disability Policy Research here at the Academy. Chelsea's videos matched up so perfectly with so much of the themes that I've found, which is really powerful. I think that, sometimes qualitative research is compared to quantitative research and, assessed using kind of quantitative metrics, which we shouldn't do, but, we look at sample sizes, but it's so striking to me, I think, just how robust some of these themes are that I see across different studies, certainly so in my participants and have experienced in my own life. I think, it started out with someone saying, like, why don't they try living with it? And I hear that all the time. People wouldn't create these policies if they had to experience it, because they would understand how impossible it is and how all-consuming it is. So many people describe living on SSI as a full-time job, that managing the benefits and all the other benefits you need to receive. If you receive SSI, you're also probably going to receive SNAP benefits and Medicaid and maybe in-home support services and maybe Section 8 housing, and they're all administered at different levels of government. And so kind of constantly juggling all of that while, figuring out when the food bank is open and what ID do you need to bring in order to access it is just completely all-consuming and really stagnates people from being able to think about alternative ways of living People want to have the cognitive space to explore work, to look at how can they be involved in their community, but really don't have either the financial or cognitive space to. I think one thing I really wanted to get into that I didn't have a chance to do yesterday was more about just how much inflation is hurting people on SSI and SSDI and how much our policies are not accounting for it, despite COLAs or cost of living adjustments. As probably many of you know, the asset limit has not been updated since I was 1 year old. So there's some disclosure, 1989. We've never updated the income disregard. And when people receive an increase in their benefits, so many people say, like, what's the point in that? It gets eaten. And they use that language. It gets eaten by my SNAP benefits because then they go down. And then I have to pay more on my Section 8 housing. And, it's like they think that by giving us $8 more, we can get something different. But people are really struggling out there, and it means people are not leaving their houses because they don't have the money for transportation, are getting more and more isolated. It's really impacting people's well-being on so many levels. I'm trying to think how to not take up the rest of this panel on this, but I think I maybe just want to end my remarks right now with just saying that, in the last year when I've been able to talk with legal service providers about their experiences representing SSI and SSDI claimants, the really sad reality is that while many of these issues have persisted across years, it is all getting worse right now. If it was hard to access SSA before, it's gotten that much harder to, first of all, get someone to answer the phone, and second of all, have someone who knows how to answer their question. And you'll give them the correct information. That this push to online services is really leaving out some of the people who are most in need of services, people who have limited technological literacy, people with communication disabilities who try to interact with an AI system that can't understand them or they can't understand it. And that the kind of rush to modernize things has really been leaving out a lot of disabled people and older adults. So I'll stop there. Thank you.
Thank you, Katie. Kevin, let me pull you in. You've long been a leader in aging policy that centers people's dignity. Based on what you're hearing, how does that sort of align these insights with how you think we need to approach aging policy going forward?
Yeah, well, thanks. First of all, I want to say I'm just terrified that everybody's staring at my shoes. And I really want to hear from Rebecca what my shoes mean about how I'm showing up for the moment. But I think my first insight from hearing all this is that we need to be thinking about a future. We're spending so much time right now, rightly, thinking about defense of all of these important programs and what they mean for communities that we care about. And we need to build a vision for a future that incorporates what we're hearing from people on the grounds. A vision that includes what we're calling the 3 R's at Justice and Aging. What are we going to need to repeal from this year plus and beyond? What are we going to need to rebuild? And then what are we going to need to reimagine? Narda mentioned this, I think, in the earlier panel about the ways that our systems have never provided everything that they need to provide to our communities. So how can we reimagine them to do so? I think the second insight I have from hearing these folks and sort of to your point, Chelsea, people are not asking for much. Even in that reimagining, they're not asking for things that are unreasonable or that we can't deliver. But I think too often our policy hears people's pain, but then provides a solution that doesn't match their pain. So we need policy that's really explicitly and deliberately specific to the pain that people are feeling. It needs to deliver. I think a massive problem in our politics is when people say they're hurting one way, they've got a broken leg, and we promise to fix it and we give them a Band-Aid. So how can we make sure policy really matches the pain and struggles and real experiences of people? And then my third point about the insight from this relates to that, in that we talk a lot about listening to people, and I think I've had some evolution in my career on this a little bit. I used to think, as a former direct legal services lawyer, my job was to bring those voices into rooms of policy experts and policymakers and politicians. And once they heard the stories and understood or even walked in people's shoes for a moment, then they could make decisions that would reflect those experiences. But I think just hearing the stories or hearing from the field is not enough. We need to be shifting power. As policy experts, we take great pride in our ability to build policy within constraints. We're always working in constraints. So we are smart people, we are creative people. Narda said there's not enough innovation. I think there's almost too much innovation. We pride ourselves in being able to outsmart the constraints that we operate in. I think the shift we need to be building collectively is the shift in not which stories are told, but where power sits. So where power sits will change the constraints that we're operating under. And right now we know more than ever, power is living with the few in our country, the powerful and the wealthy, and not with the people that we just heard on screen. If we shifted power to really hear from older adults and people with disabilities, we may not all be as useful because our great creativity and intelligence and ability to build increasingly complex and difficult to maneuver systems, we'd actually then be challenged to develop systems that were simple, that were direct, that were specific, and really tailored to meet people's, quite modest needs.
I love that. Thank you, Kevin. So the 3 R's, they were repeal, rebuild, reimagine, right? And then you're basically telling us we need to put ourselves out of work, which I think we'd all actually love. There's probably other things we could be doing. So let me just come over to you, Kathleen. We're talking a lot about what people need and want and what they're saying themselves, and there's a lot of consensus that it's fairly modest. And then someone's going to add it all up and tell us that we're asking for too much. And that's in particular going to be a challenge when we're facing issues with trust funds and, quote unquote solvency, or just being able to pay out full benefits, especially in the context of Social Security. But, there's challenges with financing and funding for Medicare as well. So how do you sort of, especially wearing a Center on Budget and Policy Priorities hat, an organization that was really, it's in its DNA to grapple with these fiscal challenges. How do you all sort of meld those two different perspectives?
Thanks, Indi. The fiscal challenges are enormous, and we really do have to grapple with it. As I see it, the two most important fiscal questions we face are, one, how to pay for Social Security and Medicare, and number two, whether we are going to be able to raise the revenues that we need to get out of the deep fiscal hole that we're in, to pay for all these wonderful things that we're imagining, and simply to continue the great programs like Social Security and Medicare that we have. So those are very real questions. They're very consequential for people, for individuals and their families. And I think we never want to lose sight of that. As Rebecca Coakley just said, a budget is a moral document. So as we go through these fiscal questions, we can't lose sight of how they affect people and families. And I think, it's incredibly important to think about not just people on average, but particular groups. How do they affect young workers? How do they affect financially struggling seniors? How do they affect people who have experienced a death in the family? These are groups that are really going, and of course, people with disabilities, always people with disabilities. We need to make sure that, each of these incredibly important groups are taken care of throughout the process. And the other thing, I think sometimes even when we're thinking about people in terms of Social Security, policymakers often kind of have this shorthand where they think of Social Security as sort of just another account, like a 401k or an IRA, and kind of stack it up against something that you might be able to get on the private market. And it simply is not that. It is social insurance. We are at the National Academy of Social Insurance right now. And in my view, the most valuable thing that Social Security provides is protection against risk. And that is so important in people's lives. So we have to always think about things like, what about the person who makes it most of the way through their career and they can't finish it because they have a disability? How are we gonna, take care of people when a dad dies, leaving minor children behind? And so I think, thinking in terms of those major risks that people face, inflation, divorce that maybe doesn't allow you to save what you wanted in one of those accounts, this is how we need to be thinking about the program to protect that essential part of Social Security that helps us manage these really enormous risks in our lives.
Well, thank you, Kathleen. Actually, just building on that, I'd love for others to sort of jump in here a bit on what you think from your perspective policymakers just need to be thinking differently about and how they need to think differently, especially as we're thinking about the future of these programs. Certainly Social Security, as Kathleen mentioned, but every one of these programs, whether it's SSI being stagnant in a way that is undermining its future ability to help. SNAP has come up, of course, and it's facing historically deep cuts, Medicaid as well, et cetera. So I don't know, Joel, I'm going to come to you later for question 2, but do you want to kick us off now, actually, and say a little?
Well, I just wanted to continue along with the theme a bit, just to add on as a cousin to the reasonableness, fairness, because I think that is something that we hear when we speak, both through the survey that we did last year, but also when we speak to older adults, focus groups and whatnot. And it comes through in the survey because people's proposed fixes are things like, why do I pay in, with every paycheck I earn, but some people stop paying in. So that was the number one thing that everyone agreed on across all parties, across all demographics, was this idea of, that there should be an adjustment on the tax max, but also things like caregiver credits. Why is it fair that somebody who takes time to care for a loved one gets a 0 in earnings for that year, and their Social Security benefit? Same with folks that are doing physically demanding work. Why is it they're facing a really big cut? If they're claiming early, so people supported fair and reasonable options that allowed for this bridge benefit that we've discussed here before, that reduces that early claiming penalty. But they didn't choose options that were just blank checks to people. They didn't say we gave options about just increasing the benefit across the board. And while I'm not saying that's a bad idea, I think people were more likely to pick the options where they found it unfair, the current situation to be unfair, as opposed to trying to level the field across the board. But
Joel, where can people find out about this?
The survey's at the NACI website, and I talked about it a bit yesterday. But what was so unique about it was that it gives people the opportunity to both learn about the program as they're going through it, but also to make those trade-offs that members of Congress are going to have to do within the next decade, and they were able to do it. They financed the program, largely through both that tax max, but also they were willing to pay more themselves.
Well, that's pretty important too. Chelsea, you want to?
Yeah, just following up on one thing there. I feel like almost like the mirror side of that fairness is that people's fundamental kind of pride and decency is actually a policy problem in a certain way, because people say again and again, I don't want to ask for a handout. I don't want to get help. People actually have a sense of, I'm a person of integrity, and I'm trying to take care of myself and take care of my own situation. We have many, many people saying in this data, that they don't want to ask for a thing, or they don't feel like they don't want to be dependent in a variety of ways on anyone, on the government, on their family. They don't want to be a burden, all of these things. And I think that there's actually, that gets taken advantage of in some way by our systems, that people are not, don't want to perceive themselves as someone who is being dependent or taking. So that's that's a problem of human psychology where, I respect that about those individuals, but it creates, I think, a policy challenge.
And Chelsea, you brought up the fact that a lot of people would have preferred planning earlier for retirement and whatnot. And related to that is we don't all know how long we're going to live. And so, Joel, I actually want to come back to you on that question. It's almost impossible to have a Social Security conversation without someone pointing out that on average, Americans live longer. But what else is there to that story?
Well, right. I mean, on average, although, it really does depend on the groups that you're looking at. And there are some groups whose longevity has either stayed static or gone down. And obviously there have been some bumps from the COVID data, but it is not a universal, and folks who rely on the program the most are the ones whose lifespans are not increasing. It's tied with, income and education in general. That I think someone yesterday was talking about an extra 9 years essentially in life expectancy, and so that's often a common discussion about, well, let's just raise the age and that'll solve the problem. I will say, even as a math problem, if you're just looking at the numbers, that is still problematic math-wise because those savings aren't going to kick in for decades. So I don't see that as a great solution on that front, but also just in general, the impact of raising that age on people who are claiming at 62 is really devastating. They've already seen that shift from 65 to 67. That is a much more substantial cut if you're claiming at 62 today than if you claimed at 62, 20 plus years ago.
Thank you, Joel. All right, I'm going to let everyone sort of do final words. Maybe Katie, we'll start with Katie. In particular, how should we sort of move forward differently on aging and disability policy and thinking about how we're all in this together? That's sort of fundamental and core to social insurance, however exactly you want to define it. How do we help people understand that, as Rebecca Coakley said earlier, or implied earlier with her story about you may not think you have a disability, but then you have a disability placard for your car to park. How do we help everyone sort of see themselves in these policies?
Sure.
Or you can say what you were
No,
say
I'm going to turn it into a response to your question, just like the comms training.
It's optional.
Okay. I think the way that we all see ourselves in social insurance is by seeing ourselves as different, unique people with different needs and not applying the same solution to everyone. I think that one piece of this conversation that I want to kind of elevate here is that across the lifespan, people who are going to end up receiving SSI may be doing a tremendous amount of work. Like Joel mentioned, they could be caregiving, they could be doing all kinds of work that's not recognized in our labor market and end up facing an asset limit that folks receiving SSDI don't. Right now, we're seeing that immigrants are scared to access their Social Security benefits, and we've seen in recent news for excellent reason, particularly now as Social Security employees are asked to give DHS their information about appointments. We know that people, Black women, that other people of color are more likely to rely on Social Security as a primary form of their retirement. And so I think that seeing social insurance as working for everyone is seeing everyone as having different needs and as really aiming for an equitable solution.
Thank you. You did answer the question. Who wants to go next? Evan.
I'll go. I'll repeat some of what I said earlier, but just that I think we are in a moment where Social Security has been under attack directly and indirectly over the last year, and those attacks are going to increase. So I think we have to be ready to defend the program and then use that as an opportunity to talk about these types of policy improvements we've been saying and long-term solutions for the program as a chance to build that affirmative policy as we do that defensive work. And then we have to be able to do at least 3 things at a time, which is also use these attacks on the program as an opportunity to build power, to have more people see themselves reflected in these programs, to understand that these programs should be most responsive to them, first and foremost, and to build those voices so that we can do the defensive work and have the energy to build affirmative solutions for the future that meet people's needs and protect the solvency of the system.
Thank you, Kevin. Kathleen?
Sure. Yeah, I'll circle back to risk. I mean, I think that, when FDR signed the Social Security Act, he said we can't protect against all the hazards and vicissitudes of life. And I think that but we can, the Social Security is going to take us a long way in protecting us against many of them, at least financially. And I think that's something that people can really relate to, especially now. I think, we're obviously facing an inflation risk that we haven't faced in over a generation, where there's a looming threat of an economic downturn. We all face risks to our health and to our lives and in our families too, that might require us to take time off or do caregiving, unemployment, all kinds of different things, divorce, all these things that we face risks, and they're going to throw us off track. We can't perfectly plan for our retirement or perfectly protect ourselves against death and disability, and our families financially. And so I think speaking that language of risk is something that people understand very viscerally. We all are worried about the uncertainties that we face. We're all worried about what might become of us or our families, not just if, but when one of those risks comes our way. And so I think that's a really important way to think about how these policy discussions affect real people.
Thank you, Kathleen. Joel?
Yeah, I'll just add, I think part of the issue around Social Security is people will throw their hands up in the air and say, it's not going to be there for me, and it's unsustainable, and that is not actually what we found when we've talked to people. People are willing to contribute more just to get the same benefits, the benefits that were promised to them. And I think if we could find a group of people across all categories that could agree on solutions, then it is incumbent upon us to share that information with Congress and to pressure folks to make policy decisions and recognize how vital this program is. I mentioned this yesterday. 4% of people in the survey said Social Security is not or will not be an important part of their retirement income. All the rest of them, including people making over 200 grand, they still value Social Security and will be relying on it in their retirement. And again, to protect against any number of risks, including outliving your savings, and inflation, which are two real big risks that Social Security protects against.
I just want to come back to the idea that policymakers need to actually have real understanding of what is going on in people's lives. I actually think that policy is made by folks like us in this room. Some of you are the ones who have written that legislation. I think that if everyone in Congress had actually pulled all of their own teeth, we would have a different kind of dental provision in this country. If you actually have the lived experience, or you have spent a significant amount of time talking to people who have had those kinds of experiences, it changes the way that you think about what is important and necessary. So I would just encourage everyone here, if you have not actually done, significant time in the field, as we say, talking to people who are having the experiences that you are focused on, I would absolutely encourage you to do that, because it will profoundly enrich the way that you think about these policy questions.
Thank you, and thank you to the panel